Okay, it's just past 8 o'clock. I'm not even sure if this is working. I've got my phone in front of me for the first time ever. I'm very nervous because in theory, tonight marks the first time we're actually doing a simulcast, which is fancy talk for streaming to two places at the same time. I'm looking at the running community, who hopefully we are actually streaming out to as well. The running community is live now. There's a little bit of a delay. I can see myself. Just take those little wispy bits down. Fine. Okay, I've never done that before. That's good. Well, good in a non kind of self-worship type way. Right, welcome. Episode 46, Runchatlive. I'm so glad it seems to be working. Yes, so very excited for so many reasons tonight. Firstly, the subject matter, above and foremost, is we're going to be looking at the fantastically important topic of returning to running post-pregnancy. And we're fortunate enough to have two of the leading world, I would say, leading women's health physiotherapists with us, Grainne Donnelly, perfect pronunciation, and Emma, not Broccoli, as I mentioned a while ago, but Emma Brockwell. And they're going to be with us very shortly. And it's fantastic because why am I so excited also that we are streaming to the running community on Facebook? It's because that's what this is all about. Runchatlive is about getting evidence where possible to runners via therapists a lot of the time, because you're going to go and see the therapist. So if I, with the help of my guest, can educate the therapist, the idea is that that information gets disseminated down to the runner. But hey, if we can get through to the runner directly, then even better. Because interestingly enough, some studies suggest it takes 17 years to get research into clinical practice. So once some research comes out, it could take 17 years, which sounds ridiculous, but that's how long it takes for things to appear in the research papers and get published and stuff, and then to appear actually when you go and see a therapist of some form. So basically tonight, what Runchatlive is doing is it's taking rid of those 17 years and bringing in the very people who published the paper. So we are actually time traveling and bringing in the two physiotherapists who, with the help of Tom Goom, who I'm sure a lot of you know, who we've had on the podcast, and is also going to be a speaker at Runchatlive conference. The three of them have provided what we're going to find out is the closest thing we can get to the definitive guide to return to running for post-pregnancy. So there we are. So welcome everybody. Running community, this is probably your first time for a few of you. I know there's a few members who watch us on the normal stream, but it works pretty much like this. You can ask questions. When I see something interesting, I can do something like this. Look, let's get rid of that greeting. Jim Gare, for example. There we go. Look, you can also see your own face or symbol up on here on the screen as well, which is nice, especially if we start getting a few runners in. So you don't have to worry what you look like. Just make sure your profile picture looks nice and you will look great on screen. But we are all about taking questions, particularly for the speakers. The speakers are very excited that they're going to be talking to approximately 14,000 runners tonight. Take it one by one, obviously, so we can get all those answers in. But yeah, very exciting. The running community, it's working. Hi, Matt. Hey, how you doing? Who's speaking on behalf of the running community tonight? Is that Alan? But anyway, yes, feel free to leave questions. If I don't get to you, then I promise you that comments will be answered later on. Maybe not straight after because I've got a Chinese ordered, but it will be later on in the week. We will get to your comments, I promise you. Right, before I do that, there is a little bit of housekeeping. I have to say thank you to my sponsors of the Runchatlive conference, the podcast and the conference, who is the Brighton Beard Company, for obvious reasons. Anybody who watches Brighton, the Runchatlive, you do actually get a discount if you use the code RCL15. If you do want to buy yourself, and this sounds always weird to people who haven't got beards or live with people with beards, but if you do want to buy a balm or an oil or a brush or some kind of other grooming product for your facial hair, then the Brighton Beard Company is the way to go. Let me give you a little idea of what the website looks like. There we go. If you go there, like I say, if you use the code RCL15, then you get 50% off. And as I said in the last few podcasts, I am getting emails and accepting emails from people who do need advice on facial hair. For example, you might notice that mine's a little bit shorter than last week. How have I got that done? In a lockdown, have I been a naughty boy? No, I haven't. What I have actually done is I've got myself one of these. I'm so conscious that I am putting products out there. Now I know that the running community are watching. I promise you it's for your own good. You don't have to buy these. It's just if you do want a great, probably the best beardscape and hair trim in the world, as you can see. Look, hair as well, all by me. Then get one of these. There's actually one which is going out free thanks to the guys at Brio. For anybody who buys one of the Runchatlive conference tickets in June, we're gonna have a little draw on July the 3rd. Hamish the physio, who's a real person, is going to be drawing the winner of that. And Hamish will also be drawing one of these, which is the fasciitis fighter, which is not a gimmick. When I first saw it, I thought, here we go again. Here's something else for me to copy and paste on my timeline to kind of call it out. But it's actually based on fantastic research to do with the big toe and kind of extension of the big toe when you are doing various exercises. So the creator of this is going to be July the 3rd. 1 o'clock is in it's in Gold Coast. I'll mention that again at the end. But yeah, there's a chance to win one of those as well if you sign up for Runchatlive Conference. We're done. The unimportant stuff, relatively speaking, apart from my sponsors, who I do love, is out of the way. But I can now bring up and introduce to you the fantastic Grainne Donnelly. Pronunciation gets better every time. And Emma Brockwell. So without further ado, if you're listening on the podcast, then you're not going to see any of the visuals. So again, I always apologize for that, which is why I say come and watch the show live. But hopefully I will tell you if any images are coming up and explain what we're doing. But without further ado, let's bring up the ladies themselves. There we go. How did that go? Oh, was that a long intro? I was worried, wasn't I? I was talking about it. I'm sorry, everybody, but now you're here, finally. I saw you giggling down there, really putting me off. I'm trying to be professional here. I've got people watching. Please stop smiling, look like physiotherapists, and introduce yourselves one by one.
I'm Grainne Donnelly. I'm from Northern Ireland, and I'm a women's health physiotherapist working in both the public and private sector. Did
you see that? I know, that's for live TV. Thank you. So I pronounce it. It's my pronunciation. Whatever I pronounce comes up. Yeah. There you go. Is that better? There you go.
I thought you were being funny in the last one.
No, that wasn't me. That was actually And if she manages to stop laughing, then we've got who else in the room as well?
Hi, I'm Emma Brockwell, and I am a pelvic health physio based in London. I feel like I'm on a game show.
Well, it's funny to say that.
My name hasn't popped up yet. I'm also a mum of 2 children who are 4 and 7 and who are highly likely to walk into this room at any point, I think. So I apologise if that happens.
Fantastic. And they're actually watching one of my favourite films at the moment, aren't they? I believe.
They're listening to Aladdin, actually, not Frozen. They're listening to Aladdin at the moment.
Tell them about Frozen. I was going to mention Frozen. Aladdin is my heterosexual stand-up. Don't mention Frozen, for God's sake. We'll delete that in the YouTube version. Right. Well, thank you so much for joining us, you two. It's very kind. So, yes, I mean, it's all very relaxed and it couldn't be more informal here. But you two have actually managed to produce, along with Tom Goom, it's a big thing, isn't it? What you managed to produce last year, was it in March? Tell me a bit about that.
Yeah, March last year, we grouped together with Tom. It was a really good opportunity, and what was quite unique about it was crossing the specialities. As I say, Emma and I are pelvic health physiotherapists. Tom's a sports musculoskeletal physiotherapist, and traditionally we've kind of stayed in our own silos, which shouldn't really happen. So it was a really good opportunity to come together and look at what the evidence can tell us about returning to running postpartum and how we can better guide women out there and health and fitness professionals who are dealing with them.
Yeah, I mean, that's the big thing. There wasn't really any guidance when it came to us considering to collaborate on this. And the interesting part of doing the guidelines was that we looked into all the research that was available and soon realised there wasn't that much evidence available on this subject. And both Grainne and I have had children, so we were keen as runners to get some better clarity on the subject, because certainly when I looked at returning to running after having had my first, I was a sports physiotherapist at the time, and I didn't I was just acutely aware of the lack of guidance there. Some people were saying return at 6 weeks after you've had baby. Other people were saying, oh no, you've got to wait at least 3 months, others 6 months, others a year. And as a patient, or as a layman, that's really confusing, because you just want some clarity on the subject, not necessarily a recipe, but some level of guidance, which I hope we've produced by writing the guidelines.
Why do you think it took until you guys got together to do it? Why hadn't it been done before? Was there any particular reason for this? Is it specifically this area which is kind of less researched, or is it something that happens generally across running?
Yeah, I think you've hit it there by saying the lack of research. So guidelines traditionally in their form need kind of high quality evidence to feed into them. So if you think of, like, I suppose, properly organizational produced guidelines, there's a proper procedure to go by, and they do require a certain level of information to feed into them. When you don't have the research or the studies investigating this population, it becomes very difficult. Now, there are multiple levels of reasons for why there isn't research in this area, and one may be that obviously research into pregnant women carries its own risks, so a lot of times it tends to be avoided in that regard, but it's getting better, and there's certainly more of a magnifying glass on this area now. But we did it, and I suppose we put the guidelines out into the public domain in the first instance, and it was really in order to get the information out there, because you've mentioned the transition from published research to maybe getting into clinical practice and making changes, and there's quite a delay there. We don't have the luxury of waiting for 14 or 17 years for that change to come. So we wanted to get something out there. We didn't expect it to have the interest and response that it did. We knew loads of people would be interested, but we didn't really realize the scale and the hunger that existed, not just within the UK and Ireland, but well beyond that for something like this. So it really solidified why me and Emma and Tom did this and the importance of it. And we're so glad that we've been on this journey.
Fantastic. Yeah, and it's free, isn't it? I mean, just to let people know straight away, therapists and runners, if they wanted to read it as well, if runners particularly want to geek themselves up, how do they get hold of that? How do they see it? What's the easiest way?
So you can either go to, if you're on Instagram, you can follow our links in our bios, or go to our websites where the guidelines are sitting. We just ask that you put your name and your profession, or if you're not a professional, if you're just a lady wanting to get back to running or just interested in the subject, that's all we ask. And then you get the I think it's 45 pages worth of guidance. Obviously, it's not for everyone. You don't necessarily have to read the whole document to glean really a good idea of when you should be ready to go back to running, and when you shouldn't be ready to go back to running. And if you're a clinician or a fitness professional or a running coach, you can obviously use some of the tests that we've mentioned in there, which we felt at the time had the best evidence base around them for guiding a woman back to running.
Brilliant. Okay, yeah. So we've got here. So ready. I hope I didn't actually tell people at the running community to get the pen and paper ready, but a couple of websites already which you do need to, because even if you don't want to look at the 40-page guide, and I know some runners who will want to look at it, and I just love it when they come to see me. But yeah, there's plenty of other stuff on both Emma and Grainne's websites. Absolute Physio is your first one, and then Emma's is Physio Mum, Emma Brockwell. So both of those have got loads of blogs and information on there. Okay. I think what I like about most of the speakers, all the speakers I have on here, all have this common trait of firstly being modest, and you've already shown yourselves to be ultra modest, and secondly, can be understood and appreciated by both therapists and runners, which is what it's all about. I've seen both of you talking, I've listened to both of you talking, and I'm always very conscious that I try and have a therapist ear and a runner's ear to imagine whether I could enjoy both this. And hands down, definitely, runners and therapists could go to both of your websites and appreciate and all your streams and everything you do and learn from it, which is great, because that fits in lovely to Runchatlive. That's what we want to do. So yeah, make sure you've got those websites done. We've already got some questions coming in. Sharon Headley, she doesn't seem impressed enough with what you've done. She's got a question which is like, okay, very interesting. She's talking about running, post running. Yeah, very interesting. What about, okay, Sharon, let's bring your question up. Sharon wants to know straight away, let me get rid of that. Any research for women to return to running after twins? So forget about one baby. What about two? Is it
Well,
very
there's
much?
probably there's no specific studies that I'm aware of, but the principles are the same in terms of, so in the world of pelvic health, whether a woman's coming in after, for whatever reason she's seeing us, if she's coming in after having a single baby or having multiple babies, the approach and the principles are still the same. So certainly have a look at the guidance, the load and impact test, and all the information feeding into it will still provide you with the information that you need to consider your own individual journey. And that's what we want to highlight about these guidelines. Emma's already said they're not prescriptive. They're not protocol in terms of like you do this at this week. They're all about giving you the information in order to look at each person as an individual, because two people at 12 weeks postnatal, one might be ready for return to running and the other might not. But that's what the guideline will help you feed in and find out.
Cool. And I imagine as we look through the advice you're giving tonight, I mean, it's not always a case of if you have twins. There's going to be so many cases today where it's obviously bloke talking about pregnancy and not knowing enough. But just because it's like having kids, isn't it? Just because you've got two doesn't mean it's going to be twice as hard. In fact, it's not. It's 3 times as hard. It's not a good metaphor. But if you have twins, it doesn't mean you're going to run into twice as many problems or have twice as long before you go back to running, is it? There's not that correlation.
No, not necessarily. It's about thinking how your abdominal wall has healed, how well your pelvic floor has healed, and then obviously how well your whole body can take the various loads that are required for running. And you might find that unfortunately some ladies who have had one baby but have had a really severe perineal tear take a lot longer to go back to running than someone who's had twins and not had the same issues with their perineum or their vaginal area. So it's very patient specific.
Which kind of answers John's question here. John came in a second ago with, what's this about? And after that answer, John, I think that's going to probably help you. I've just tuned in, so there you go. You've got time now. We're talking about return to running, John, and different complications that can arise and what we can do to reduce the risk of it. So there you go, John. Hope that's okay.
Do you think everyone knows what a pelvic health physiotherapist is? Give them a bit of an idea,
because they might. This is such a rushed job with the running community. It was like, can we go on? Can I do it? Can I simulcast? Yeah, okay. There's going to be a lot of people go, oh, this is interesting. What's this? Did she just say vagina? What did she
say vagina? I might say vagina a few times.
Okay, we can guarantee tonight there's going to be quite a little lesson in anatomy and physiology. And we expect questions as well regarding that. This is it now. There's what happens in Runchatlive stays in Runchatlive. It's fine. So, okay.
I'm looking at the question. The question feed is making me laugh. So if I go off on one, I'm not laughing at anything. The question feed is making me laugh.
I know. I have to select this carefully now. I want to go. Yeah, thank you, Matt Scarsbrook. Thanks for joining us. Right, let's ignore Matt Scarsbrook for a moment. I can tell tonight I'm going to have to stick to my crib sheet, aren't I? Let's start with the big question. The first question, which most runners are going to want to know, female runners, is there a time on how long it's going to take after they have their baby for when they're going to be able to run again?
Our guidelines give the idea that you are looking to think about a return to run, a gradual return to run at around about 12 weeks of having had a baby. Now, as we've already said, that isn't, it's very specific to the person. So you might have a lady who presents with no pelvic floor symptoms, which I'm sure we'll talk about in a moment, who has had a really lovely pregnancy and been able to be active and strong, and who presents with good strength and ticks all the boxes that we discussed in the guidelines. So they might be 9 weeks postnatal and therefore ready to return to running. But as we say, it might be someone that's 24 weeks postnatal and is only then ticking the boxes to return to running. So we use 12 weeks as an idea of that's when we think there's enough time to recover, and so long as you don't show any signs of pelvic floor dysfunction, and as I say, mention you're reaching all the test markers that we illustrate, then that's when we would suggest a gradual return to running. So I guess 12 weeks is your ballpark figure that you're looking at, but it's not necessarily applicable to everyone.
And with that in mind, do you think that the answer will vary depending on who you go and see?
That's the current problem as such, and that's one of the reasons that we developed the guide. Now, even last night, I was going through my social media feeds, and I seen somebody putting out an educational post. It was actually quite a good post, but they were putting out a post about if you have a normal delivery, you can go back to high impact exercise at 6 weeks, and if you have a C-section, it's going to be 12 weeks. But we basically know that that idea of the 6-week check is something that has been traditionally thought of, and women basically get the impression that they wake up at 6 weeks postnatal and they're automatically recovered, and it doesn't really take into consideration that individual's journey. So we want to redefine that and basically get people thinking more about the healing times being 12 weeks, because when we looked at the literature and we considered pelvic floor trauma and healing and considered abdominal wall recovery, in particular with post-surgery such as C-section, we know that the healing time extends well beyond the 6-week time frame. So that's what we want to debunk. And we kind of purposely didn't section out a difference between normal delivery and cesarean section delivery, because again, sometimes when these are boxed, it becomes very prescriptive. If you have a normal delivery, you just automatically turn that's easier. But somebody can have a normal delivery and have a very traumatic delivery, and because of the nature of it, they don't talk to people, they don't tell someone that they're having pain, symptoms, leaking, anything like that, and they're the ones that go unrecognized as kind of having a risky return to run. So we wanted to create it that there's a general healing time of 12 weeks. There's certain load and impact tests you can do. There's lots of information for every therapist, whether you're health, fitness, whatever area you work in, you can kind of skill up on. It's not that it's out of your remit, and we need to stop boxing women off from the lower tummy to the top of the thighs and start thinking that that part of the body is under everybody's remit as well.
Very good. I like you mentioning that as well. Obviously, you are treating a person rather than just a vagina. There you go, John. It's 2 now. You can tick them off. And it's big. And I love to hear you both talking about that, how you're both very aware of other factors, which, for example, especially with pain, but with everything, all of the physiological responses are definitely connected to what's up here as much as what's down below. It's very current. Stick on that subject. Can you give us an idea of some of the tests which maybe people are going to see all of the time when they go and get tested for, am I ready to go run again? What are some of the tests which are very current? And in saying that, maybe some which are less accurate, which your guide points out and shouldn't be used quite so much, or maybe some which you think should be used more and are not being used enough? So
we sort of split it all up into pelvic floor and musculoskeletal testing. So from a pelvic floor perspective, that's where you'd really need to collaborate with your pelvic health physiotherapist, because ideally we would recommend that all women have an internal pelvic floor assessment. And during that pelvic floor assessment, we're trying to determine how strong the pelvic floor is, what sort of level of endurance the pelvic floor has, ideally in a functional position standing, because that's where we run. We also want to look at the structural support of the pelvic floor as well. So when it comes to considering things like pelvic organ pressure, which is where your bladder, bowel or uterus descends into the vaginal area, we want to look at protecting those vaginal walls. So it's really important that we're assessing what structural deficits there might be. So that's where someone like Grainne or I would come in giving that level of testing. From a load and impact testing, from more of a musculoskeletal point of view, we're looking at, can women do various things without experiencing certain signs and symptoms like low back, pelvic pain, any signs of urinary incontinence or fecal incontinence, any heaviness or dragging when they carry out in the vaginal area, when they carry out certain tests like walking for 30 minutes, single leg standing, hopping, forward bounding, single knee bends. And we would go by sort of 10 reps for each, and if they're managing those tests without any signs of pelvic floor dysfunction or any pain, that's where we can be thinking, yeah, okay, good, we're on the path to recovery, and we might use those tests to then help strengthen the lady if they're presenting with some elements of dysfunction there. We do also look at some strength tests as well, but this is where Tom came in really, and it seemed that the evidence for those tests was pretty vague, pretty poor. So things like oh gosh, what was it? Single leg calf raises, single leg abduction, side lying abduction.
Sit to stand from a chair, single leg glute bridge, abduction, side lying. Yep.
Thank you for being my memory. So we use those tests really because they seem to be the muscles that are most specifically used when running. I'm not sure, you might be able to tell us if there's any more specific tests that perhaps we've become more aware of since we wrote these. We really wrote these back in August 2018, so perhaps there's been more awareness of that. I know Chris Johnson's done quite a bit more testing, more research in that area, but that's the broadness of the testing, which women can test themselves. If they can carry those things out without any key signs and symptoms, then that gives them a good idea as to when they're more run ready.
And how standard, I mean, it's impossible to say what percentage, but in your experience, what sort of proportion or percentage of women are going through symptoms and just ignoring them and not getting checked out because of ignorance or fear, whatever the reason are you hoping that the guide actually changes that? Is there a lot of female runners out there who are worsening the what's going to happen in the future because they're not getting checked out?
Well, if you think about it, like any symptom of pelvic floor dysfunction, whether that's leaking, whether that's heaviness in the pelvic area, whether it's pain, it's a sign that the area is not managing or matched up to that load that's been put on it. So if you think about pelvic health, like we think about sports injuries or MSK injuries, and just apply the same principles, you would know that maybe the load isn't right for that particular area, and you would scale back, strengthen up, return to play, so to speak. And we need to be taking this similar approach with pelvic health, because the thing is, women are suffering in silence, and they are maybe just accepting that as this is just par for the course. And we tend to find so many women 5-10 years down the line, significant issues. And once you start doing rehab with them and start educating them, I hear time and time again, why didn't someone tell me sooner? And that message and that education isn't getting out there. And it's hard because me and Emma, we surround ourselves with pelvic health related health and fitness professionals. So you can think we're quite tunnel visioned and thinking everybody knows this, but there's a whole big bad world out there of people who don't really understand. So what we want to highlight is that women who experience, whether it's with running and exercise or whether it's not even with running and exercise, after having a baby, if you're leaking from the bladder or bowel, if you're having a sudden urge to go and having to make sudden dashes, if you're having pain, if you're having pain with intercourse, if you're having a heaviness or dragging sensation down there, these symptoms might be common, but they're certainly not normal, and they're a sign that more rehab needs to be done.
Yeah, and I think a big thing there is as well, don't be embarrassed by those symptoms. Don't not talk to a healthcare professional or even your coaches about those symptoms, because what's so frustrating is they're so very treatable as well. But they're that common that 1 in 3 women are leaking urine after baby. So that, it's happening to more people than you probably think. So by talking, asking for help, it's there. Use us, definitely.
And one of the big things that we're quite passionate about ensuring is that these sort of symptoms are actually one of the biggest barriers to women having to regress and stop a certain form of exercise. And we know the importance of physical activity, meeting the government guidelines, 150 minutes, and for our overall health and well-being. So if we're now identifying a huge barrier for these women in maintaining that exercise, that's a public health crisis. That's something we need to address. And we need to look deeper than accepting, like, women aren't going to say, I'm not going to the running club anymore because I have a leaky bladder or I have a prolapse. They're going to say, do you know what, I have childcare issues, or my husband's working, I can't get away. They're going to come up with any other excuse. And so they're just going to fade away into the background because of that. So we need to do better to bring these topics up, to talk to people so that they can go, okay, well, maybe I can seek help about this. And maybe that doesn't become a barrier. And maybe running clubs start to design tiers of, even postnatal tiers, so that women are having an easier kind of couch to 5K return type approach, things like that, so that we're starting to make people fit, but also protecting their longevity in their ability to maintain exercise.
Okay, so it's really interesting. I never thought of that angle. So it's not just a case of the information hasn't been there to be given by therapists. It's a case that a lot of women are still embarrassed or just don't realise that they should go and see someone. They just think it's just part of it. So there is getting that message out there. Very interesting. Right.
Yeah, and also when you think, oh, sorry, Matt.
No.
I was just going to say that, you know, I think traditionally we've been quite used to being told that oh well, you leak urine now because you're a mum, and that's what happened when I had a baby, and you know, and it's these things that need changing, because yes, they absolutely probably did happen when you have a baby, but to accept that as part of your new normal, you should be able to get on that trampoline with your kids and not leak urine. And you know, we're not just talking running here, we're talking something as simple as getting on the trampoline, so running, having a little game of football with your toddler. It's devastating if you feel you can't do that because you're leaking urine, or because you've got feel like you've got heaviness in your vagina. And it's just so frustrating outside when you know that we're really effective at treating this stuff, and there's grade 1 evidence for treating pelvic organ prolapse, urinary incontinence, and improving sexual function from a pelvic health physiotherapist point of view. So I just wish every woman had the opportunity to see a physio postnatally. It should be part of the postnatal pathway, in our opinion anyway.
When you say had the opportunity, you mean it should be encouraged more as a form of kind of like midwifery or something, or after having the baby you've got to come back? And
I think it should just be part of your postnatal recovery that you see someone like me or Grainne. Yeah.
Right, I really want people, if we are going to the running community, I'm hoping that some of you have suffered from prolapse. No, I'm hoping that some of you actually have some experience and can and join in this conversation and share some of those experiences. Has anyone there suffered in silence and then maybe gone to see someone and wish they'd gone earlier on? So do please use the comments if you can. Also, therapists out there, I'm very interested. I mean, I have not got any. I've got experience of working with female runners who have needed help getting back into running afterwards. I'm aware of some of the little running form changes. There was a question earlier on which made me realize this, to do with running uphill. There was a question. Let me just find you. Where were you? There we are. Let's put it up. I'll put it up on here and I'll read it out. This is Jess Parson. She says, I listened to one chat you did, probably not me, probably Grainne or Emma, but one chat you did and mentioned that running uphill puts your body through less impact and could maybe be a good substitution for those with itchy feet. Would you then recommend they walk down the hill? 3 years later, and I think I still have a little bit of the fear when I hit the downhill, but in those early days, would you say to walk? Question.
If you're having symptoms with downhill, so yeah, it depends on if you're having symptoms. If you're not having symptoms downhill, that's okay. And actually, what we want to eventually get to with running, once we train up and are postnatal, you want to be hitting the ground running and having that reflexive pelvic floor. So that should happen automatically. And that's actually, when it does, that's actually a really good form of training for the pelvic floor, because you're initiating it with that impact that it can take and it's responding. So it's a nice training exercise. But if you're going downhill or you're in the earlier days of postnatal recovery and just starting to kind of test out return to running, it might be an idea to certainly slow your pace going downhill or walk, especially if you're having symptoms. Uphill running, people often think is more difficult and harder and more strenuous because it feels more strenuous on our lower legs, but it's a really good exercise. It puts less impact on the pelvic floor. It does still give you a nice workout of your lower limb muscles. So it's a really effective way of grading back into exercise. And the other modifiables are, if anyone is having symptoms and is really keen to maintain the run and doesn't want to regress from it, change the terrain, like change your what you're hitting. So ideally not tarmac or hard surface, go to like a country trail, a grass trail, something like that, because that will lessen the impact as well.
Anything to add to that, Emma?
No, spot on.
What she said. Yeah. No, it's interesting advice, because I mean, I think most running coaches, I definitely always harped on about the fact that most runners think they avoid hill running, so they think there's more chance of getting injured, but you're actually more likely to get injured running full out on a flat and reaching that speed and that repeated impact than doing a 10-second hill sprint where you're just going maximum as hard as your body can push you up a hill and then having a recovery thing. So it's good to hear that the same thing goes with return to running post-pregnancy. Embrace those hills.
I also think though running uphill gives you good. I have got something to add actually. Just a latent.
Oh, good.
I think it gives you a great opportunity to access your glutes as well. And postnatally, women don't have great glutes, quite frankly, because of the postural changes, centre of gravity changes that have happened. Also, when you're breastfeeding, hormonally, glutes become affected as well. So getting up those hills gives you an excellent opportunity to fire those glutes up, which is going to give you more pelvic stability. And glutes are your pelvic floor's best friend. So if we can fire at the glutes, it's going to help. That's going to help everything, essentially.
That's good. I'm going to let you guys get away with that because normally I spend my time saying it's not all about the glutes. It's not all about the glutes, but the link between the glutes, you know, when we used to talk about the TA and just focus on the multifidus, and that was the most important thing and contracting that, but it's everything that attaches to the pelvis, and there's not much which attaches to the pelvis more than the glutes. So yeah, look after the glutes, particularly in this case. And yeah, it's nice to be able to just let that go by without feeling the need to criticize it. But yeah, and the other thing I like about hill running as well is, and the idea, I can imagine that for someone who wants to get back to running and has got that stress and desire to feel like human again and a person, you can let it go going uphill in your sprints. You can actually feel that part pumping, and I'm alive again. You know, I'm not just a baby machine anymore. I'm actually me, and that's going to be far more rewarding than plodding along to do like a 5K in the park thinking this is nowhere near my PB. So there's a lot to be gained. It's good.
Yeah.
Oh, that answers your question, Jess. Thank you for that. Let's have another look down here. Jack Chu is in the house saying, I'm taking twin notes. Fantastic. Do you follow Jack? We know Jack, obviously, but I love his control and test. Fantastic. Thank you, Jack, for coming. And are the rumors, actually, Jack is saying as well, are the rumors true that you're going to be speaking to Therapy Live?
Plugging himself.
Yes, it is true. It is not a rumor. It is true.
Oh, what a bombshell. Announced on here. It's nowhere else on social media.
The three of us, right?
Actually, oh my God, I just realised I'm going to be, when is it? Is it soon?
Oh, it's on next Friday.
It's next Friday. I better start writing something then. In fact, have you booked your calendar date to understand how you're going to do it? I'm on a Monday. So, Jack, under control here. One of your 3 out of 9 speakers. We've booked our calendar of how to do this. Yeah, so just to explain why we're all looking like Cheshire Cats, June the 26th? June 26th, all day CPD Friday. Myself and also Emma and Grainne are going to be 3 of 90 speakers providing free CPD all day long. And again, I think there'll be something for runners as well as therapists on that, especially since it's free. You do have to register. And if you've got any questions, then ask Jack Chu. Right, there you go, Jack. Go on. Unbelievable. Daryl Kruger, who came to Runchatlive conference, which is happening this year on the 29th and 30th of October.
Oh my God.
Daryl Kruger from South Africa. He's got a question for you as well. He says, Emma, you're coming out with a book in January. Just on an online course of Julie Weeb. How do you pronounce Weeb's surname? Is it Weeb?
Yeah, Weeb. Yeah.
Good. Julie Weeb this week on running and postnatal mom. This is new for me. Very interesting. Combining pelvic health, musculoskeletal health, and running exercise performance. Book coming out in January, Emma. Is that definite now? Do you realize it's coming out in January? Is that news to you?
I love you. Yes, I have got a book coming out in January that I haven't yet finished writing. And it's basically talking about I've got feedback, sorry, so I can hear myself talking. Can you hear me okay?
I can hear you okay. There's a bit of feedback. That's okay. We'll let it go. The content is worth it.
Yeah. It's basically telling women what to expect during pregnancy, childbirth, and after pregnancy. The things we should be telling women, like the fact that they might experience pelvic floor dysfunction, like the fact they shouldn't be just rushing back to running after their 6-week check. Just giving them the realities in a nice, comforting way, and how to manage those realities, because I just don't think we educate women enough about the realities of pregnancy and childbirth, and in the 21st century these are really things that we should be telling women, for not only the preventative reasons but also so that they know that they can get treatment. So yes, thank you, Daryl. My book is out in January. Thank you very much. It's called Why Did No One Tell Me by Emma.
It's called? I can't wait. And I can't help thinking of it. It'll double up as a child reading book as well. I can read to my 5-year-old. I can just imagine the way you've written it is probably. I don't know if that's an insult or not.
I'm
Let's
not
move
sure
on.
how to take that.
I can imagine it's just pink and flowery and wonderfully written. That's all. Let's move on.
Exactly.
Mark Burrows,
It's
question
going
from
to say
you.
that I'm basic.
No. I'm saying that you are multi-layered. I don't know. I can't get out of it as a whole. Hold on, just take my foot
I'll
out of
take
it.
that whilst my son has just popped on. Do excuse me while I just mute myself and
Okay, yeah, go for it. All
I'll
right,
be
you go
back.
for it. I've got a question from Mark Burrows, who's actually the creator of the running community. So this is nice. Mark is saying, a question from me. I'm going to ask on behalf of my wife, as she is an IBCLC lactation consultant and not here. Okay. I'm going to act as if I know what IBCLC stands for. You two are nodding like you actually do know. How does running post-pregnancy affect breastfeeding? There we go. That's the question.
Nice question. And that's a really important topic. We do have a small section on this in our guideline. There's, again, the research is limited about this. I'd be actually quite interested if your wife knows of more research, but we've referenced anything we can. We wanted to reduce the fear about breastfeeding and running because a lot of women have misconceptions that milk supply will be impacted, and really there's the research demonstrates that even high intensity and vigorous running has not impacted the supply. You might have to make some considerations around feeding more for the comfort of the mom, so that she doesn't end up with really, really heavy, uncomfortable breasts with running. And a big important part of this is bra fitting and making sure that you do get a bra fitted. Most women actually shockingly don't get fitted for a bra and certainly don't get fitted for sports bras. They usually buy off the shelf. We should be getting fitted. Our breasts fluctuate and change in between pregnancies, after pregnancies. So it should be something, particularly if you're going to go out and do high impact exercise such as running, that should be considered. Emma, do we think of anything else in terms of the breastfeeding that I've missed?
I think the thing with breastfeeding is the hormones, and there's always been this common concern that there's all this relaxin in our system when we're breastfeeding, and that can mean we're at higher risk of injury. What we're thinking now, and again, there's very little research, is that yes, when you initially start breastfeeding, there is still a higher level of relaxin, but that levels off, and actually the hormone that we're challenged by more is the lack of estrogen. And when there's a lack of estrogen, we have less tone in our muscles. It certainly affects our vaginal tissues quite significantly. So we just have to be mindful of the fact that if you are breastfeeding, there might be a little bit more of an increased risk of injury, particularly if you're hypermobile. But ultimately, there's going to be less, we think, muscular tone or support, I think is the best way to describe that. And therefore, we just want to be a little bit careful and suggest perhaps that rather than running on trails, you're running in more of perhaps a park rather than the muddy, boggy trails where you're a little bit more risk of injuring. But yeah, Grainne's hit it on the head. There's just not that much research out there, and I think the bras are the big thing, and women just do not get refitted for them at all. So that's a massive tip. If you're breastfeeding and want to run, have a bra fitting.
And the other thing is that it shouldn't be that idea of the risk of injury. It is quite individual. Sorry to be putting it. It is quite individual. It's not something to be feared about, and it's not something to think anyone who's breastfeeding is going to have this risk. It's only an issue if it becomes an issue. And I think just continue on your path and return to running. And it's only if you start to get niggles that you might think that that's part of the consideration for your individual journey. But we don't want these blanket rules of, oh, you're breastfeeding or you should stop breastfeeding if that reduces your risk, because really we know that it's so minimal. It affects, as Emma's already said, it's more likely people who are already hypermobile anyway, or who had issues structurally anyway. So yeah, we need to decrease fear. And I know lots of runners who are trying to debunk the idea of breastfeeding being an issue. And even in terms of, a lot of women worry that when they come home, the baby might be a bit put off if they're sweaty, and that might change the taste of the milk. And I know lots of proper high performance athletes and runners who totally debunk that. As soon as they're in the door, the baby is ready to be fed and will feed off them, no problem.
It sounds ridiculous. Do people actually say that?
There's lots of theories and fears and things that are thrown out there. Yeah.
Well, people who don't exercise. Yeah, that's fair enough. I understand that. The sweat puts the baby off. They've obviously never seen a baby breastfeeding before. Jesus, nothing would put it off. Anyway, for most of them. Right. So thanks, Mark. Great question. I hope that helps answer you. There's a question here from Matt Scarsbrook, which is a sensible question this time. I didn't do your first question, Matt. I just vetoed it. I thought, no, that's not going to come on. But we'll give you your second question because you actually thought about it and respected our guests. Let's have a look. Proper question time. Prehab has good support prior to procedures like ACL reconstruction for better outcomes. Is there any research supporting certain types of prehab women can be doing during pregnancy and in the run up to birth that improves their chances of a quicker, more successful return to running? The common assumption is Kegels, but is that accurate? There you go. Good question. I was going to ask that. Thanks, Matt. So anything you can be doing during or in the run up which can reduce that time after?
100%. Exercise in general is hugely promoted through pregnancy. We have, thankfully, as time has gone on, we've got the Canadian guidelines which came out, but even more recently, like the CMO, our Chief Medical Officer, have put out wonderful infographics, and they're really promoting exercise during pregnancy. It's been shown to be safe. There used to be lots of fears about exercise being unsafe in pregnancy, unsafe for the baby, unsafe for the mother, and a lot of those have been debunked. And it's just about being sensible. There's certain things to watch out for in pregnancy in terms of you don't really want to become over-exertional as the pregnancy comes on. So they talk about having a scale. What's the scale called, Emma? I know we've talked about this recently. For breathlessness.
It's exertion, but then now they're saying that it's really the talk test that's the significant test.
Yeah, and that you should be able to talk and have a conversation while you're exercising. And the other thing is just being careful not to overheat, or if there's any signs and symptoms such as fluid loss, blood loss, contractions that are coming up, it's kind of an indication that you need to get checked out. But most people who are exercising, who continue to exercise during their pregnancy, actually have a more straightforward pregnancy, a more enjoyable pregnancy. They're fitter, and the principles totally apply in terms of what we know from sports and MSK world, in that if you're fitter going into pregnancy and labour and delivery, you usually come out of it fitter and have a more seamless recovery, which makes sense.
Yeah,
definitely. Yeah.
And obviously pelvic floor exercises are really important as well. And there was some fear that if you're doing pelvic floor exercises, is it going to tighten your pelvic floor or your vaginal area so much that then you're going to struggle to give birth vaginally and tear? Actually, the opposite's been shown. If you're doing your pelvic floor exercises, it's considered that you'll have a more effective vaginal delivery and possibly even a quicker delivery as well. So pelvic floor exercise is very much advocated during pregnancy.
I can see that's a really good debunking.
And to be
there.
particular,
that's really good. Yeah.
He asked about the type of exercises. So other than pelvic floor exercises, the CMO guidelines recommend cardiovascular. So you're looking for your 150 minutes, and it should be made up of cardiovascular, but also strength training as well. So they're getting the combination of both, just like the adult guidelines are recommending. So if anyone, even if you Google the CMO physical activity guidelines, you'll find the one for pregnancy and postnatal. It's a lovely infographic. It's really clear.
I'm interested in, because I was there living the kind of core explosion and when Pilates really took off kind of 2000 based on the research. And then since then, we kind of know that you can activate these muscles standing up from your chair and doing a squat. And a lot of these muscles are activated from doing normal exercise, like you said. So I'm very much embracing what you're saying, Grainne, about just do exercise, as simple as that. You haven't got to worry so much about putting a bit of rope around your tummy and pulling your belly button away. But in specifics like this, is it more specific? Is there a set of specific core, for want of a better word, or pelvic floor exercises that women should be doing, which you wouldn't do normally, which you couldn't just achieve by doing your normal deadlifts or squats or whatever you're doing? And if so, what are they?
In terms of pelvic floor, you certainly should be addressing both fast twitch and slow twitch fibers. So the fast twitch are simply engaging your pelvic floor, letting go straight away, ideally looking to get 10 times, so 10 quick flicks. You also want to do your slow holds because they're your endurance fibers. So they're the things that, particularly for runners, make sure that they can continue and get to the end of a run without leaking. So anyone who finds that they're okay for the first 3/4 of a run, and then all of a sudden they find that they're having a leaky bladder, that's a sign that they don't have fit enough, or the endurance of their pelvic floor muscles isn't good enough. So you want to draw on your pelvic floor, be able to hold it in maximally for 10 seconds while not holding your breath, and repeat that 10 times. So I do think in pregnancy and postnatal, it is important to focus in on those and do those isolated training, which then carries over into normal exercises, and you're more likely to maximize the response to them then.
Yeah, I think if it comes to any protocol based exercises, when you're thinking about your tummy, if that's perhaps where oh God, Matt, who was just asking the question? Sorry, you just
sorry, Matt Scarf,
yeah, sorry, Matt. Yeah. So are there any specific exercises, strength exercises that you should be doing? There's nothing that's specifically advised. I don't know, Grainne, because Grainne is an expert in diastasis or diastasis. I don't know if you found any evidence that there's specific exercises that help diastasis after pregnancy. I'm under the impression there's not, but
during and after pregnancy, the research shows that we don't know of specific exercises that there's no one size fits all. What we do know is that with, I suppose, pregnancy and diastasis, the rectus abdominis muscles are impacted, and rotational movements tend to be impacted. So they're the muscles that we tend to want to keep strong. And that's where we need to debunk myths and things, because there's a lot of misinformation about abdominal separation after pregnancy. And there's a lot of things about don't do sit-ups, don't do rotational or oblique movements, because that's going to pull your abdominal wall apart. So then we created like this population of women who find it really hard to sit up and really hard to do normal mom tasks, which usually require rotation. So we need to stop boxing out areas of the body and nearly safeguarding and protecting it to the detriment of everything else. And we need to start just knowing what areas get impacted and keeping people strong and functional. And we know great examples of people who have managed to be so functional and have proven the point that just being strong is important. But it's like, I always think for diastasis, and technically pelvic floor as well, but particularly diastasis I see a lot of, and I always try to explain it to women like bone healing nearly, that it's all about getting the load right at the beginning, because if someone has a fracture, somebody might be partially weight bearing, somebody might be fully weight bearing after that fracture. It depends on what the consultant decides, basically, because it depends on what level of load they're ready for. And if they start at the right entry point, they usually progress quite well. If they load too much too soon, that can be detrimental to the rehab process and keep them back. If they underload, they don't stimulate enough bone healing. And I think diastasis healing, certainly in my clinic practice, that's the way it seems to follow suit as well. You have to get the level of load right to begin with and progress. And that's an individual call. And so I really think prescriptive protocol treatments are a no-no for me.
Fine. It's interesting. I'm glad in a way we're talking about we're running out of time, unfortunately, but if we're going to focus on anything, I know, Grainne, you've got a particular affection for talking and researching into diastasis or diastasis. We never agreed, did we? But I recall, in case anybody listening, or I'm sure there's bound to be some women who have suffered, the right word? We've got to change that sort of vocabulary, haven't we? Experience.
Experience.
Better, isn't it? But talking to Matt Fitzgerald, those of you who've watched Runchatlive a few months ago now, but Matt Fitzgerald was talking about an athlete who you guys were familiar with, I was pleased to know, Steph Bruce. I'm just going to bring up a picture up here. So Steph Bruce is a professional, very elite athlete, runs with the NAS Elite in Arizona, and she was fairly ahead of her time in embracing the diastasis recti that she experienced after the birth of her second child. That was her running with the baby. It was interesting because she was kind of condoned by a couple of people on social media, which is easy these days. She was running up to about, I think the first child was 31 weeks or something, and the second was 29, and people kind of say, you shouldn't be running with that baby, you're doing it harm, which we kind of know depends on the individual, and it's kind of fear mongering. But then after having the second child, she produced a picture like that, which is, I suppose, is the kind of thing which we need to be embracing and not fearing, and for people not to be thinking, oh my God, there's something terribly wrong with me.
Totally.
And also, she wasn't actually diagnosed with it until she'd actually been out running about 3 weeks after her second child, and then started experiencing some heaviness and some problems. And then she went to get checked out, and they noticed it was only then that she had, like, I think it was 3 fingers worth. But yeah, tell us a little bit about this, whether it's obvious enough, whether women could be testing it themselves, what clues they need to know in order to get checked out, and what you can do about it.
Okay, so diastasis is really just a fancy word for abdominal separation, and it's basically where the linea alba is connective tissue, which is in the middle of the rectus abdominis muscles. For anyone who isn't au fait with the muscles, we're talking about the six-pack muscles. So that group of muscles that people traditionally think of having that six-pack definition, there's a little bit of connective tissue running down the center. And to be honest, it's probably a very smart piece of connective tissue, and it's probably there by design on purpose, because guess what? When women get pregnant, the abdominal wall expands and that tissue gives a little bit of give. We know from research that it depends. The problem is we don't have a definitive diagnosis as to what indirectly distant defines diastasis, which is a problem. But we know that all women experience some degree of separation towards the end of pregnancy. So we need to start debunking the fear around it and start to think that it's actually a normal process. Now, 2/3 of women normally resolve without having to think about diastasis. It's that 1/3 of women that Steph likely falls into that we need to start thinking, right, we need to get them access and rehab, because symptoms they might have are this pendular abdomen that extends significantly beyond the normal healing process after having a baby. So if people are starting to find they're getting into shape everywhere else except their tummy, or as they get more into shape, the tummy becomes more pronounced, or if they're getting up from lying and they find this kind of pointing of their tummy, even though they don't have a baby or a bump or anything anymore, that sometimes indicates it. And lastly, what Steph had shown there, actually, if you're able to sink your fingers into your tummy and they sink in, that, yes, exactly, that picture there is a really good visual of what I suppose diastasis is. There's nothing hugely to worry about with it, because a lot of women have it and actually, like Steph, function really, really well, get strong, get fit, get back to everything they need to do. A lot of women can undergo rehab and actually find that the diastasis or the gap reduces and that doesn't become as much of an issue. And it's really something that we want people to consider, because it can be a factor into someone's readiness to return to running. It wouldn't stop someone running, but it could be something that they need to maybe train up and strengthen some of the abdominal wall muscles in, because if people do become quite fearful of it and avoid certain movements, we know from the research that that sit-up or that rectus abdominis muscle function is impacted, and so is rotational movements. And then we think, as I said already, if we think of our moms, what do they do all day? They lift stuff, they rotate, or they need to. And so it's trying to make sure people are fit and we prevent other problems occurring.
Emma, anything to add to that?
No, because I have to apologise for the fact my children were talking to me the whole way through that. My husband's not here.
I just wanted to give you the opportunity, that's all.
But you just wanted to show that I...
Yeah, don't leave you out there. No, but there's a wealth of information. I know if anybody is interested in that, then there's so much information that you two offer and people can read about it and hear about it. I think you've done podcasts on that, just that subject alone. So there's loads of information people get. It is something which I think male and female athletes and clinicians need to know a little bit more about. I'm not sure whether it helps showing photos like that, but maybe that is something we need to embrace and go, actually, it's just normal.
It
does help,
yeah.
But initially for some people, it could do the opposite. It's kind of like, where do you fit on that line of exposure? But that's our goal, to be able to think, but anyway.
Well, right. I'll be thinking about it on Friday. So if anyone's interested, tune into Therapy Live. And
Therapy Live. Oh, yeah. The rumors are true. Oh, damn it. Look, we're running out of time. Let me have a little look through the comments just in case. I do appreciate you sharing so much on there. We are reading them. When you see Grainne or Emma bursting into hysterics, it's normally because they read something about someone being told they had to give up breastfeeding because their daughter's head was too small, things like that. Thanks for sharing that information. But yes.
Can I jump in and answer? Because I seen one come up that was a really good question about the lower estrogen that Emma had mentioned.
Oh, yes.
And they asked, was this the same in postmenopausal women? Absolutely. That's a huge consideration. So a lot of postmenopausal women actually need to get topical estrogen to actually replenish and to help plump out the tissues and make them more lubricated. The dryness in the tissues actually impacts the function. So it often makes their ability to do what they do as muscles it compromise them. So it's really, really important that we do consider that and do address it. And anyone in that population of postmenopausal women having issues running, the principles that we talk about in the guidelines, even though they're targeted to postnatal women, the principles apply. So there is no guide for postmenopausal women at the minute. So the principles of, do you have these symptoms? Can you do these load and impact tests still apply?
And that's all to do with the estrogen. Yeah. Sorry, Matt, I wasn't going to choose you. I wasn't going to give you 2 questions in a row, but Grainne saved you then, so there you go. But no, it's a very interesting point. Listen, people, if you have got more questions, I really hate this only an hour. I'll have to make this 2 hours in future. But anyway, if people do want to contact you, let's have to get that information up first of all. If people have got more questions, then obviously they can go to your websites. But what's your best method of communication, Emma, for you? If people want to reach you quickest, where should they write to?
Instagram is probably my quickest, to be honest. Yeah, please.
And on Instagram, who are you?
At PhysioMum UK.
PhysioMum. I'm just bringing it up for the people who are maybe watching. I suppose there's not many people watching with the sound turned down, but let's just do that. Anyway, there you go.
So snazzy, isn't it?
Again?
So snazzy, this.
Well, thank you. That's Live TV. Go to my website for more details of how to use this software. And for you, Grainne, what's the best way of contacting you?
Yeah, Instagram as well. I'm at absolute.physio.
Absolute. Is that without an E or with an E?
With an E.
Okay, so it's not like the vodka. And that's .physio. Absolute.physio. Is that it?
Yep.
Yeah, perfect. There you go. So yeah, and I know you're both really active as well. It's fantastic that you find the time to actually put so much quality information out, and I thank you on behalf of everybody for it. We're out of time, I'm afraid. There's so much more questions I wanted to ask, but we're out of time. But I'm hoping that, as I always say, people, especially those of you in the running community, if this does, this was the first time we've gone out to you guys, so if it does spark off some more questions, and I didn't see it, what was it? Keep that comment feed going. It's an open page, so we can all go in there and add and suggest and put links in there. So do use the running community on Facebook open page to keep the conversation going, and go to those websites. Right, I need to let you people go. Thank you so much for joining us, Grainne. We didn't get to play our Irish name game. I'll have to save that for another time.
It was too good. It was too good. I'm just so glad you've nailed the name. Now you've put the pressure on everybody else. So anybody introducing me, even for anything else, has that to go against.
We all got it wrong in the past, didn't we? I think everybody, and it'll still happen. It's good. It makes you unique. Emma's simple. No, I didn't mean that in that way. I mean, Emma, the name is simple. So.
This is the second time you've implied that I'm simple and basic.
No, say what it's pretty what you write. Okay, right. We need to go. So thank you so much, and hopefully maybe in the future. Well, I know that unfortunately, Grainne, you still can't come to Runchatlive conference in October. Still got a better date.
No. Yeah. I think Emma's going to fly the flag in this one.
Yeah, okay. Well, we'll talk about that later. Thank you, Emma, for joining us. So yeah, Emma, unfortunately, Grainne can't join us, but Emma will be there either in person, or if it does go virtual, then we'll all do it online, which I hope it does. I want us all to be in there in person.
Yeah.
But anyway, we'll see how it goes. Right. Thank you so much. I'm going to put you back down to the lobby, but I will come down and thank you officially. I'm just going to say goodbye to the people watching. So thank you,
Thanks,
Emma Brockwell and Grainne Donnelly. Thank you so much.
Thanks.
Oh, you don't know how difficult it was to get that name right every single time. Right. Grainne. Actually, in my crib notes, I've spelt it Gronya. That's how I spell her name now. So if I look over and read it, it's Grainne. Right, people, what do I need to tell you? I hope you've enjoyed tonight, especially running community people. Thank you so much for joining us. The video will obviously stay on the page. You can watch the repeat if you haven't joined us live. And remember, you can still put comments in if you are watching the recording. That's fine. It also gets uploaded to YouTube, to the Runchatlive channel. It goes to www.runchatlive.com. And it's released as a podcast. So if you prefer to listen to it, if you want to listen to it again whilst you're out running, or doing whatever you like, then within a few days it will be available on all the normal podcast apps, and on Spotify and on iTunes and all that. So we do try and put it out there in every single possible way so you can actually hear us and what our wonderful guests have to say. Right, all I need to say is just to mention once more that we will all be around. In fact, all three of us will be around on Friday, June the 26th, which is a whole CP day on Therapy Live, thanks to Jack Chew and Co. So do join us on Friday. I'm on 2:30 in the afternoon. I'm not sure when they are on. Just looking down at the cameras. Emma's on at 9 o'clock in the evening, and no, 9 in the morning maybe. Is that right? 9:30. 9:30. Both of them 9:30. There you go in the morning. So they're on the. There you go. You haven't got to choose between us. What a much simpler world. And also then, as far as Runchatlive goes, we'll be back on July the 3rd on a Friday. I have to change it to a Friday sometimes if my guests are, well, in this case, they're in Australia. On the Gold Coast. So I'll be talking to Hamish the physio, Hamish Vickerman, about basically plantar fasciitis, which is a hot topic for a lot of runners. So join us on July the 3rd at 1 o'clock UK time for that. Okay, it's been a fantastic evening. Thanks once again to my wonderful guests, Grainne Donnelly and Emma Brockwell. And yeah, I hope you've enjoyed it. Leave us some comments, and we'll see you again very soon. Take care and keep staying safe.
You're listening to Runchatlive podcast, putting the evidence back into running injury and performance.